Again, I'm telling the task. Task is that suppose Ronnie is a 11-year-old boy. He has headache, that is tension headache diagnosed. But his mother Mira, she wants to do some test. She wants to know what is inside that. Now I have to convince him about tension headache, and I want to talk. Okay.
Okay.
Hello. Good morning.
Good morning.
I'm Dr. Emma, one of the children doctor in this hospital. I believe I'm talking with Mira, mother of Ronnie.
Yes, doctor. I'm Rooney mom.
So, Mira, nice to meet you and thank you very much for coming here. Today, I'm here to talk about Ronnie's health condition. Is that a perfect time for you?
Yeah, it's perfect.
Mira, before I start, do you want anyone to join this meeting or shall I start?
No, I'm alone today. You can talk to me, doctor.
So, what is your update about Ronnie's health?
Ronnie has been having terrible headache. It's been quite a long time, and I'm really worried whether there might be something wrong inside the brain or not. I think we should arrange imaging scans like CT scan. How do you feel, doctor?
Yeah, I understand you're really a keen mother, but I have to tell you one thing, Mira. After examination of Ronnie, after doing all things, we reach a diagnosis that Ronnie has a tension headache. So, do you have any idea about the tension headache?
Many of the doctors told me this, and I'm not quite sure. Okay, can you tell me why is the what is it, and why my Rooney is having these headaches?
Yeah, tension headache, it is a headache. What happened? Some people, when face their stress, they react like that. Then this headache develop. Ronnie has maybe now facing any stressful situation. That's why his body is reacting like headache is developing. Am I clear so far?
But doctor, isn't it possible that you might miss serious brain tumors while you are focusing only on these non-serious like tension headaches without doing investigations?
Uh, Actually, when the headache, we have some criteria. We feel that after examining Ronnie, we don't find any negative finding. So that's a tension headache. May I know why you want to do the test? Is there any specific reason behind that?
Yep, my mom, she passed away with a brain tumor, and before she passed away, she presented with the headaches, and doctor told the same like is this because of stress and not eating properly. But about a month later, my mom's developed a vision problems. They do the imaging, and then they found out this is a brain tumor. I don't want that to happen to my child.
First of all, Mira, I'm really sorry about your mother. Actually, I don't know what has happened with your mother, but I want to tell you and to reassure you that, Ronnie has not like that. People and things are different case to case. Ronnie has tension headache, and we're confirmed about that. Okay?
Are you 100% sure? But is there any, isn't it any specific features that you can tell me that you cannot say this is a serious one?
Yeah, I really admire your knowledge. I have to tell you this point. When we diagnose the headache tensions, there are some warning sign or red flags. And I have to tell you, if you find this type feature, you seek immediately the medical advice. First of all, the features are, any morning vomiting, he's wakening from sleep for this headache, severe headache, sudden onset, blurring on the visions, nausea, like that features, if develop, then yeah, that is we are telling. But I want to know that is confirmed that Roni is suffering tension headache, and I'm giving some treatment about headache. How does that sound?
Well, it's quite interesting that my Rooney doesn't have any of features you mentioned, so I'm happy to listen. So what is your plan for her, for him?
Yeah, for his plan, first of all, we are offering him some painkiller. We'll take this regularly according to how we are telling. And another one to I tell you that we are involving a doctor, what we call cognitive behavioral therapy doctor. He will give Ronnie how can he handle his headache in healthy way, healthy stressful situation. How can he handle? Okay. And also, Mira, I want to tell you something that Ronnie can maintain a diary about his headache. Like he can be identify the trigger of the headache. Some people have some triggers. Some people's hungry disease. Some people taking excessive caffeine. Some are have exams during exam time, school time. They have developed. So First, Ronnie need to identify the triggering of the headache. He can maintain a diary, and after that we can work. Okay, how does the sound?
That sounds perfect, but is there any specific reason we could not do the imagines or any problems if we do the imagine at this time?
Yeah, Mira, I'm seeing how much keen mother you are. You're really good mom. But I have to tell you that the CT scan we can do, you are telling. But CT scan, it's really a scary machine. And Ronnie need to be motionless for a long times, which is quite impossible for children. And it's radiations. So, and we are giving this unnecessary. We know that nothing inside his brain. And that's why, for this hazard, why we face Ronnie about the stressful conditions. Where treatment is to avoid the stress. Are you following me?
Yes, doctor. Yes, Mira.
Okay.
Oh, no, no, yes, doctor.
So, have you any other concern?
No, doctor. I think it's quite clear.
Okay. May I summarize what we discussed today for better outcome?
Yes, please.
So, Mira, today I have told you about condition that he is suffering a condition that is called tension headache. I already told you what is tension headache and also how can we manage this. The treatment I told you and some red flags or warning sign I have given you. If you find all this, you can seek the medical advice. Okay. And
All right.
also, Mira, I'm giving some trusted website in leaflet about tension headache. It will be helpful for him. And also, I'm adding you a support group where you find lots of people who have tension headache and how they're handling the situations. How does this sound?
It sounds perfect. We will try your suggestion fast and we will see. Thank you so much, doc.
You are most welcome and thank for your patience of time. If you have any time, any doubt or any question, you can ask me. I'm here for helping you. Okay.
All right.
So
Thank you.
wishing Roni's quick recovery. Thank you.
Thank you, doctor.
You have not asked me. I'm from Middle East. That's why you are not doing.
No,
You
no,
have not
no.
forced me for MRI of the brain. No problem. The
No.
answer will do
Mhm.
that. And also, if you
Yes.
complain that I want to go another hospital, the answer will be that every hospital will do this because this is best for Ronnie. And again, complain, then false. This is
Yeah.
okay. Then thanks.